Hello everyone, you're watching Nukta. I am Kurutalen Mohsin, and today Dr. Fazeela Abbasi is back with us. She's a renowned dermatologist and pioneer in aesthetic medicine with advanced training from King's College London. She has become an international authority on regenerative medicine, stem cell therapy, and anti-aging treatments. Welcome again, Dr. Fazeela. How are you?
I'm very well. Thank you, Kurutalan. I'm so glad I'm with you on this podcast once again. And I hope the audience is loving it. I believe that's one of the reasons. And the second reason is, which I really want to tell the audience, that I feel like I'm talking to a very sensible human being sitting in front of me.
Taken. So today we will be talking about hair fall, which is one of the biggest concerns in Dubai, and I think many parts of the world. Women are, going through hair fall. No matter how many shower filters, bottled water bottles, or expensive shampoos people buy, they can't get rid of this problem.
I think it has become a pandemic and it's unisex. It's not just affecting females, but I would say, Kurutalan, it's affecting both genders. All age groups, they are afflicted and inflicted by this pandemic.
Before we get into the prevention and treatments and causes, I'd like to ask you what normal hair shedding looks like compared to actual hair fall.
That's a very great question. So when you read the scientific literature, it says anywhere from 50 to 100 hair strands, they can fall every day.
Yeah.
But in real life, if 50 to 100 hair strands, they fall out of your scalp, you're going to go crazy and cranky.
That's a lot.
That's a lot.
50 and 100 hair strands
is a lot.
Of hair.
Exactly.
And for somebody like me who has very long hair,
yes,
if I would shed 50 to 100, they are going to be so long and it's going to be a bunch.
It's going to be a bunch.
Freak
yes,
out.
Yes. So that means it's going to be very different for everybody. Let's say you're losing your hair normal than what you normally do, and only you know what's normal.
Dr. Fazeela, if you could summarize the reasons of hair fall in men and women.
First of all, it's the genetics. If you do not have hair, a very thick hair and not too many hair, then you take it as a genetic gift. Or it can be a great gift, it cannot be a very good gift. Diana's sons, they are handsome, they are wonderful, but from the top of the head, they're becoming bald. So what exactly is wrong with them? They don't have enough iron levels, they don't have enough vitamin D, or is it something else? They're not getting enough food. What's going on? They do not have a good water to clean their heads with. What is it? That means genetics. So when there is genetic propensity or the genetic predisposition for someone to have the hair thinning and the hair fall, it will happen no matter what. When you understand that this is what the genetics have given me, then you make the right lifestyle choices. There should be no nutritional deficiency. When I say nutritional, that doesn't mean macros. We're talking about micronutrition. Meat is going to have all the right kind of pulses and vegetables, a bunch of nuts and grains, which is going to give you all the right kind of micronutrition like selenium and zinc and magnesium. And if you think you cannot make up for that deficiency from the diet that you're having, that you can also incorporate the multivitamins. So when I say multivitamins, the multivitamins for the hair and the nails and the skin, they're going to be slightly different from the other ones. Number one, it's genetics. And then is other factors that, let's say, from female point of view, hormonal imbalance. There is an imbalance in the hormones and you start losing hair. So we see a lot of polycystic ovaries these days. We see a lot of polycystic ovarian syndrome and disease these days. We see a lot of thyroid issues. We see a lot of hormonal imbalance in form of raised male hormones in a female. So we're talking from a female point of view. And then you keep on questioning, like, where are these chemicals coming from? Why these females they're more hairy on faces and bodies and no hair on the head? What's going on? I would like to label the chemicals in your food, the chemicals in your food chain, in your water supplies, in your cosmetics, in your perfumes. technically the environment is intoxicated with chemicals and they are disrupting the hormones, not just in females, but in men as well. When you look at the sperm count, when you look at the quality of sperms, when you look at the infertility issues, you would like to blame chemicals in your food chain. You would like to blame chemicals which are everywhere. You're surrounded. Basically, you're drenched with chemicals everywhere and anywhere. So hormones, that's the number 2 thing. And then comes the basic deficiencies in the very basic stuff, like the iron deficiency. That can be in a female because of heavy menstruation. You know, she has fibroids, she has polyps, and she has hormonal imbalance, and she's bleeding a lot. So it's not that she's not taking enough iron, and maybe she is. She's not taking enough iron because a lot of people, they just like to eat vegetables and they're not having enough protein. So the vitamin D deficiency and the iron deficiency and the B12 deficiency, which is supposed to be like the very basic thing in you, is giving you a worse hair fall because of the genetic predisposition. Maybe in someone else, he or she is going to gain weight. Maybe the third person is going to have melasma. Maybe the fourth person is going to have some other kind of a problem because of the gene expression. So at the end of the day, if I really have to summarize it into one line, I would say it is genetic propensity and predisposition for the hair thinning and the hair fall. Maybe your parents, they have full head of hair, but you don't have it. That means, yes, you picked certain things from the genetic pool, but then you have your own genes. Yes, and there is something called the epigenes. Epigenes means something which is on the top of your genetic makeup, and that would be the lifestyle choices that you make for yourself. What you eat, how you take care of your hair. You cannot do the gene editing. You cannot do the gene therapy. So what can you do then? You're going to do the best that science is offering you. If you do not save what the nature has given you in the form of that visible asset, you cannot create that asset for yourself again. So that's why the richest people who we see in this world, they are bald. They cannot buy the hair follicles, even the amount of money that they have.
Yeah.
So you need to save the asset.
In Dubai, everybody is blaming water.
Yes.
Everyone blames the water, and they say that since I moved here, the water here is harsh. I am like basically becoming bald and my hair is different. I don't know my reasons, because since I moved here, I've had 2 kids and a lot has changed, and I have lost half of the hair that I used to have on my head. So I really don't know what was the reason, but yes, it definitely did play a role in it.
Does the environment has an impact on the well-being of your hair follicles? Yes, the answer is yes. That's why a lot of people who come to me, they're like, ever since I have moved to Dubai, I'm losing hair. Ever since I moved to London, I'm losing hair. Ever since I moved from this and this place. So environment and epigenetics and lifestyle choices, water, they have an impact on the well-being of your hair follicles. Yes.
Can frequent use of these styling products, can they lead to permanent hair loss as well?
Everything has to be done in moderation and you can enjoy the benefits of it. So I won't really say that the hairdryer can be a cause. If you're going to use mild temperature in your hairdryer, it's okay. If you're going to use too hot, it's not going to make your scalp happy. If you're going to use too many chemicals in your hair and then you're not going to clean it at the night time when you're retiring to bed, it's going to have an impact on your scalp. Scalp is a piece of land where the crop and the trees are growing from. If you're going to be consistent in your approach in bombarding your scalp with those chemicals in a very consistent manner, yes, eventually it's going to have a toll on the well-being of your hair follicles. But if you're going to do it like once in a while and then you've been very careful in using those chemicals, then it's okay.
How many times should one wash their hair?
Very subjective, but I have a rule. Scalp, shampoo, sweaty. So S, S, and S. That means when you think that your scalp is too sweaty, and again, it's different. Maybe I'm working out on a daily basis. Maybe I'm someone who sweats a lot on the scalp. Maybe I'm cooking and cleaning in my kitchen every day and I have a sweaty scalp. Maybe I'm someone who takes hijab. Maybe I have hair which are stuck in my hijab, and whatever I'm taking on my head as a turban is going to make me feel sweaty. Then I think it should be cleaned the moment it's sweaty, because when there's too much sweat, that means that now you're encouraging the growth of the bacteria, which can be harmful. It's like I tell you not to brush your teeth. Brush your teeth twice a week, and you'll be like, hold on, doc, what the hell are you saying? I have to brush my teeth regularly.
If they're not sweating, if their hair is clean, they don't need it, are they supposed to put the chemicals in their hair every day?
Not at all. And that's why, Kurtalan, I'm saying there are two extremes then maybe. One of them is not cleaning and cleansing because they think my hair fall is going to get triggered. And then there are other lot who keeps on just doing something like putting the dry shampoos, but you don't understand the dry shampoos, they are loaded with chemicals.
So we've talked about the causes. Now let's talk about the treatments. So what's the difference between topical sprays like minoxidil, oral tablets, and medical procedures like PRP?
So let's discuss topicals first.
Yeah.
I think what you can have over the counter when you're going to go and talk to the pharmacist, the first thing that he's going to point out is go take minoxidil. What is minoxidil? Minoxidil is a vasodilator. A lot of my patients, they have shown reservation in using minoxidil. So when you look at minoxidil use, you'll be like, if I stop using minoxidil, will I lose more hair? And there are two ways of looking at this. I do not agree with it because you're trying to make those hair follicles strong by giving them more blood. Now, if you stop giving them more blood, they're going to regress to the same stage that you had started your journey with, right? And the hair fall will happen because those hair follicles are going to become small and weak again. And patients perceive that as a worse hair loss. They're like, no, I'm not going to use it. Now, there's something called placebo effect. If something is in your mind and brain, nobody can change it. If you know that after taking a DHT receptor blocker orally, I'm going to have sexual dysfunction, that man will have that problem. Even if you give them gummy bears, they still have that problem because it's placebo effect. So if someone thinks that minoxidil is going to make their hair fall worse, I don't give them that. I tell them, we have a very scientific debate and a discussion, but still if I feel that no, this is something which is stuck in their head, I like to give them peptides. So the topical peptides are going to do the same job as minoxidil, but minoxidil is the only ingredient which is available over the counter. So when you would like to have a DHT blocker, if you would like to have a peptide, then we have to seek help from a compounding pharmacist.
Definitely.
So I think that's how the topicals should be used with that kind of a concept in your hair.
So we have talked about the topical treatments, and even these treatments can't be done without an expert's help, I would say. Now coming towards the medical procedures like PRP, stem cell treatments, they are becoming very popular in Dubai and in other parts of the world as well. Everybody is getting them done. So can you explain to the audience that how do these treatments work?
Like this video? Find more stories like this on the Nokta app.
Absolutely. I think there's so much confusion in the word stem cells because everybody thinks like stem cells is like the ultimate game changer and this is like a stellar treatment without realizing where the stem cells are coming from. You would just like to know what works for my hair follicles, and from the stem cell bank, the ones which are taken from the back of your scalp, the ones which are made in the lab, the allogenic and the bone marrow derived stem cells, they work wonders in saving the hair follicles that you have. So they're not going to make new hair follicles. Please remember this. And I think that's the takeaway message. You cannot create a new hair follicle till date. That's why you have to save what you have. Once you have lost everything and that asset is gone for good. And that's when people, they start relying on that little strip on the back of their scalp, which is called the donor area. So they keep on losing hair and they're like, you know what, I'm going to get the hair transplant done one day.
Exactly. That is my next question from you, because I have came across so many people in my life.
Yeah, don't worry.
Men, especially.
Yes, especially men.
That,
I'm
it's
going to
okay,
get it done.
Let it go a little further.
Yes.
And then I'm going to get a hair transplant.
I'm going to fly to Turkey to get it done.
Is that
everything? It's a roadmap is in your mind. It's gone. It's gone. So that means now what you have done is you have lost everything. And now you were relying on that strip on the back of your scalp. And now you went for the hair transplant and they're going to take some of the hair and they're going to put them in the front. Natural acid chala gaya aur wo natural acid wapas nahi aayega. So hair transplant is a wonderful procedure, but hair transplant is a cosmetic procedure which simply means that you have uprooted some of the plants and the trees and the hair from the back and you have put them in the
Put
front.
them in the front.
But it's not going to save the rest of your hair on the rest of your scalp. वो एक अलग procedure है जिसमें PRP-derived exosomes to stem cell recruiters and stem cell therapies are done along with the topical sprays and everything, because to save a hair follicle is one hell of a task. And that's what I tell my patients. You can lose them, you can lose your hair very easily, but to save them and to preserve them, it's one hell of a job. And you need to be in professional hands. So for all those uncles and aunties who are thinking that, let me lose all my hair and I'm going to fly to Turkey, I think you need to stop for a second and give a second thought. And that is going to be the thought of saving what you have. And of course, if you have lost way too much from a certain part of your scalp and the hairline is not coming back the way it should have been, then please get the hair transplant done. But otherwise, the jungle is on fire and you need to put out the fire.
I'm going to be talking about some myths. So you're going to answer if they are myths or facts.
Okay.
So the first one is washing your hair every day can cause hair fall.
Yes.
It's not a myth. It's a fact.
Yes.
Shower filters or bottled water do make a difference.
Yes.
If hair fall starts once, it's permanent and you can't do anything to change it or stop it.
False. We can do so many things to prevent it.
Yes. Coconut oil cures baldness.
False.
It can't.
No.
Shaving your hair can make it, healthier.
Old wives' tale. False. False, 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 please.
Vitamin D alone can fix my hair loss.
False. Along with vitamin D, you have to look at many other things that we have spoken about.
Yes.
But yes, vitamin D is one of the most important vitamins, not just for the hair fall and the hair thinning, but the well-being of humans, I think. And I think that's still something which people are not able to understand in a complete way.
Does pumpkin oil regrow your hair?
Pumpkin seeds and pumpkin oil, that's a natural DHT blocker. You keep on rubbing it and scrubbing it and thinking that the hair follicles are going to sprout through your scalp, you're living in a fool's paradise.
So
but
if somebody
yes, of
wants
course,
to use the topical,
that's an adjuvant. That's
Yeah.
an adjuvant treatment, but that cannot be taken as a solo treatment.
These are some male celebrities that are rumored to be getting some hair treatments done like PRPs, but your
Oh my gosh, my
expert-
brother is in this again.
your expert opinion, I will be asking you that what these gentlemen have done to their hair. So the first one we have is Virat Kohli.
Must be having PRP-derived exosomes. Everybody must have had stem cell recruiter treatments. Everybody has gotten them done. But I think what I can tell from the hairline that Virat Kohli has, that he must have gotten hair transplant as well. From the hairline, I can tell. But I might be wrong.
Now we have my favorite, Atif Aslam.
Atif, I'm so sorry if I'm...
I have seen like a major difference in Atif Aslam's hair condition, I would say.
He definitely had hair transplant, and I think he must have had hair transplant more than once.
What treatments Elon Musk might have gotten done?
Well, I think Elon Musk went to Mars and he had some stem cell treatments done in hands of an alien. But I think the gentleman has been very smart. He
Fun.
has definitely been on a very intensive and intense hair-saving treatments at his end. And then he must have had hair transplant as well, for sure.
Him as well.
Absolutely.
The next one up is Fawad Khan. What kind of hair treatments he might have done?
Oh, God. I don't think he got a hair transplant done. I don't think so. I think the hairline seems very naturally woven. If it's not natural, then whoever has done the job of transplanting hair, he has done an amazing job. But I think he hasn't got the hair transplant done.
Yeah.
I'll be surprised and shocked if he says yes. Now you're putting a
Preserved.
gun on my head and make me say stuff. So, because they're all friends with my brother and
I
in
know.
this one community.
Not saying
so-
anything wrong. If someone is doing something right, people should know that what is it.
Yeah,
Just
we
like
need to
Hamza
know
is
all the
okay with
secrets.
it. सबसे पहले मुझे सबके secrets पता होने
Oh,
चाहिए.
God.
और मैं बाद में, when the camera is like off, I'm gonna be asking her a lot more questions. I always pick her brain. Now,
and thank God that is never recorded.
no, of course, it's between us.
Yes.
The next one is your favorite, Ibrahim Al-Samadi.
I don't think he has had hair transplant. And I think he should be having something to save his hair. But I think apart from PRP, it seems like he's not doing anything. But all I can tell from the hair is that he needs to have a thicker hair. The hair is thinning. And he needs to do something actually about the hair.
Okay, Ibrahim, you need to see Dr. Fazeela now because she has some treatments suggested for you.
Yes, and he's a good-looking guy, so he needs to take care. It's like a frame, you know. So if the hairline is receding, then you definitely need to pay attention.
Now we are getting some family secrets out. The next one up is Hamza Ali Abbasi.
So Hamza, mera bacha aa gaya. He actually looked at the interview that we shot.
Yeah, he did.
I'm like, are you okay with the fact that I said I do your hair stem cells? And he said, of course, you know, Api, I'm okay with it. So I think when Maulajat came, I still remember that Noori, the character that he played, it had a hairstyle where we could see, the audience could see the hairline. And the movie was on the shelf for, I think, good 4 and 5 years. So in 4 and 5 years, because when you're looking at someone on daily basis, you cannot say that something is happening. When I looked at his, the hairline after 5 years of that movie being shot, from the before and after pictures, I made a picture and I'm like, you know what? I think you have a receding hairline, maybe by 1.5 millimeter, which is like a very small, tiny difference, but the difference was there. So he's a very smart boy, and he said, Api, can we save it? Can we keep it the way it is right now? And I said, yes, we can do the stem cells. And that's when I think I give him a yearly treatment. Sometimes when he has time, we just feel like doing it after like even 6 months. So I like to do his stem cells along with the exosomes. And now he has luscious hair.
So we all need a sister like Dr. Fazeela.
And you have to ask him this question, you said.
Yeah.
Remember you said I have to ask him, how does it feel to be Dr. Fazeela Abbasi's brother?
Whenever he's free and he's visiting us, you have to tell us when. But we all need a sister like Dr. Fazeela to treat us this way, who's able to catch our hairline receding or our skin
by 1 millimeter. Maybe you're going to hate me for that. It's like, it's just 1 millimeter.
I want that sister in my life to point that out and fix it for me.
God.
So Hamza, very lucky you are. And for Hamza Ali Abbasi, everything that Dr. Fazeela said is correct because she is the one doing all the treatments. But others, it was like her expert opinion.
Yes.
But she can't tell for sure that if they have gotten it done or not.
No, but even if I knew them,
I
probably, it's a patient-doctor privacy. But since he's my brother and I know that, he won't really mind. So it's my family. But otherwise, I know there's so many people, but still, I just have to keep my mouth a bit shut.
Okay, so coming towards the final questions, what is the biggest mistake people in Dubai might make while treating their hair fall?
Nobody likes to get the labs done. Even when they go to the doctors, they're going to put them immediately on minoxidil and just a random hair supplement. Why are you not customizing it? Why? And I think it's not the patient's fault. You're coming to a doctor and the doctor has to come up with a bespoke treatment plan for you and only Kurutulain. It's Kurutulain's hair. Kurutulain has different factors operational in her life. She has given birth to children. She has this kind of a lifestyle. So I have to find out the causes and the factors which are affecting you. So it has to be a customized protocol where the labs are done, where you try to find out the causes and then you put them on topicals, but in a very scientific and a logical way. You do not send them back home just by giving them minoxidil and not guiding them properly. You have to make them understand what the DHE receptors are, what are the blockers, how you're going to get them compounded in a pharmacy, what kind of supplements you're going to have, but those supplements cannot be random supplements. I think I'll never be able to understand why the doctors, they give random supplements. And there was a time, I have to be very honest with you, I swear to God, I felt like hitting myself, Kurtulan. The patients are walking out and they're like, Doctor Sahab, koi supplement batayenge? And I'm like, how do I know how much you need? How do I know what your body is like? Like patient तो नहीं मैं बात कर रही, लेकिन patient के साथ let's say उनकी अम्मा है और उनकी बहन है और वो जाते जाते मुझे भी कोई supplement बता दे. And I'm like, your sister got the labs done, and that's when I can tell what she needs.
If someone is listening right now and is suffering from hair loss, what's the first step they should take before spending, lots and lots of money on treatments and products?
I think get the labs done. Just get the lab work done and see what's happening from inside. And then just seek professional help and go about it in a very sensible manner, like starting with the topicals and starting with the PRP-derived exosomes. If they think PRP is the only thing which is available, then I would say something is better than nothing. So try to just kind of preserve the hair follicles that you have by giving growth factors. And if you think that this is something which comes within your budget because the stem cell treatments are a bit pricey, it's going to be more affordable in the coming few years. But if you can get your hands on stem cells and nothing like it. But as I said, it's a very holistic way of looking at your hair follicles and to save them. It cannot just be taking care of your iron deficiency and the vitamin D deficiency and you think I've done my job. Of course, you have to do all these other things, keeping in mind that the topicals, they also have to be used in a sensible, in a systematic way.
Amazing. Dr. Fazeela, thank you so much for your time again.
It was a pleasure being on your show.
I hope that our audience can, take away all the good things that you had to say and the tips and tricks from this conversation.
I will be very happy if I think the audience can just grab one takeaway message, and that is, this is a natural asset. Try to take care of it. Try to preserve it. Do not lose the natural asset in hope of getting the hair transplant done. Hair transplant is a wonderful procedure, but it can never be an alternative to saving your hair follicles.
And I'm going to be taking your advice very seriously.
Absolutely.
Because she has great hair. So I think she's the right person to be taking this advice from.
Thank you. Thank you.